This is the story of an actual patient named Luke who received treatment with Danielza. What is Danielza? Danielza is a prescription medicine used in combination with a medicine called granulocyte macrophage colony stimulating factor, GM-CSF, to treat children 1 year of age and older and adults with high-risk neuroblastoma in the bone or bone marrow that has come back, relapsed, or that did not respond to previous treatment, refractory, and has shown a partial response, minor response, or stable disease to prior therapy.
It is not known if Danielza is safe and effective in children younger than 1 year of age.
My name is Rochelle Leedy. We have Luke, who is 5, and Carter, who is 1. Before I became a mom, I was a teacher, and I love that.
My name's Bill Leedy. I'm a high school teacher and a high school football coach. So my son Luke was diagnosed with stage 4 high-risk neuroblastoma.
I had been speaking with his pediatrician, and like I knew something wasn't right. You know when your kid isn't feeling themselves. He refers to a radiologist, and they found the mass, and the mass was the size of a football.
He went through 6 chemotherapy treatments. He went through a major surgery. He went through radiation, and he ended up having a relapse. Most difficult moment was when Luke relapsed, because it was the first time he got off schedule, because you just went through what you went through, and essentially you have to start over. And it was sort of like, okay, where do we go from here?
I feel like the main thing for me, just focusing on one day at a time. That was such a huge strategy for myself as a parent, dealing with this journey that we've been on, is just one day at a time, just focusing in on your child and helping them to be a kid as much as they can be a kid going through this.
And I sort of felt like my role was to kind of look long-term and do the research and speak to as many people as I could and really try to find the data on possible treatments.
I feel like Luke definitely would probably not have gotten the care that he got and the opportunities that he's gotten without my husband doing the research that he did.
It's a very rare disease, so get yourself to a specialist, somebody that knows neuroblastoma inside and out, and just do your research, talk to families, talk to doctors, get second opinions. Don't be afraid to ask your home hospital for a second opinion somewhere else. Do what's best for your kid. What is your favorite color?
Blue.
What's your favorite sport?
Football.
Yeah. In talking to a neuroblastoma expert, he sort of laid out everything that was going to happen, and everything he said that would happen, happened. So we knew that even if it meant going to another institution to see this doctor was our guy, because he had seen this, and he knew exactly what Luke was going through, and he ended up being the one that recommended Danielza. Danielza is an immunotherapy. It helps the body fight and kill neuroblastoma cells. So it's kind of harnessing your own immune system to go after the cancer.
It is not known if Danielza is safe and effective in children younger than 1 year of age.
Important safety information. Danielza can cause serious infusion-related reactions that require immediate medical attention. Infusion-related reactions are common with Danielza. Tell your healthcare provider right away if you get any signs or symptoms during or after your Danielza infusion, including swelling, itching, redness or flushing, and other signs listed on screen. Danielza can cause nervous system problems that may be severe, such as pain, including pain in the belly, bone, neck, legs, or arms. Talk to your healthcare provider right away if you have new symptoms or worsening of nervous system problems. Please see additional important safety information at the end of this video.
So once we talked to the doctor, they told us that we had the option of doing it outpatient with this Danielza. So when receiving the Danielza treatment, we were able to go back to where we were staying. Anytime we have that opportunity where we can make it more like home and more kid-friendly, that's definitely always something that we want for him. So distraction is key when going through the treatment, and some things that were really beneficial and helpful for Luke was that we would bring in sea turtle. That's kind of like his lovey.
So anything that would happen to Luke would have to happen to sea turtle too. It always happened to sea turtle first. So if he had to get a shot, sea turtle would get a shot first. If he had to get stethoscope put on him, it would get put on sea turtle, and then Luke would do it. So he said, as long as sea turtle did it, I'm good.
And so as our community, would see these pictures, they were always asking me about sea turtle. So sea turtle became a huge thing. And the football game that they did in honor of Luke, they actually created a sea turtle cake. And sea turtle had a cape on.
These people just rally behind you and, they're willing to do anything to help you. From the 5th grade students that I taught, all the way through the football team, the football moms, kids we never met before.
To us, every day is a gift. So any little thing he does that brings him joy brings us 2 times as much. So yeah, it really does put things in perspective.
Consumer indication and important safety information. Danyelza, naxitamab-gqgk injection for intravenous use. What is Danyelza? Danyelza is a prescription medicine used in combination with a medicine called granulocyte macrophage colony stimulating factor, GM-CSF, to treat children 1 year of age and older and adults with high-risk neuroblastoma in the bone or bone marrow that has come back, relapsed, or that did not respond to previous treatment, refractory, and has shown a partial response, minor response, or stable disease to prior therapy. It is not known if Danyelza is safe and effective in children younger than 1 year of age. Important safety information. What is the most important information I should know about Danyelza? Danyelza may cause serious side effects, including serious infusion-related reactions. Danyelza can cause serious infusion-related reactions that require immediate medical attention. Infusion-related reactions are common with Danyelza. Tell your healthcare provider right away if you get any signs or symptoms during or after your Danyelza infusion, including swelling of your face, eyes, lips, mouth, or tongue, itching, redness on your face, flushing, skin rash or hives, trouble breathing, cough or wheezing, noisy, high-pitched breathing, feeling faint or dizziness, low blood pressure, nervous system problems. Talk to your healthcare provider right away if you have new symptoms or worsening of nervous system problems, including severe pain from nerves, neuropathic pain, including pain in the belly, abdomen, bone, neck, legs, or arms. Pain is common with Danyelza and can be severe. Inflammation of the spinal cord. Signs or symptoms may include weakness in your legs or arms, bladder and bowel problems, pain in back, legs, or stomach, abdomen, numbness, tingling, burning sensation. Reversible posterior leukoencephalopathy syndrome, RPLS, also known as posterior reversible encephalopathy syndrome, PRES. PRES is a condition that affects the brain. Your healthcare provider will monitor your blood pressure and check for any neurologic symptoms after your Danyelza infusion. Signs or symptoms of PRES may include severe headache, vision changes, changes in mental status such as confusion, disorientation, or decreased alertness, difficulty speaking, weakness in your arms or legs, seizures, numbness, tingling, or burning sensation in the arms or legs, nervous system problems of the eye. Signs or symptoms may include unequal pupil size, blurred vision, trouble focusing your eyes, larger pupil size, dilated, decreased ability to see, sensitivity to light, problems urinating or emptying your bladder, prolonged urinary retention. Do not receive Danyelza if you have had a severe allergic reaction to naxitamab-gqgk, the active ingredient in Danyelza. Ask your healthcare provider if you are not sure. Before receiving Danyelza, tell your healthcare provider about all your medical conditions, including if you have high blood pressure, have heart disease, are pregnant or plan to become pregnant. Danyelza may harm your unborn baby. Your healthcare provider will do a pregnancy test before you start treatment with Danyelza. Females who are able to become pregnant should use effective birth control, contraception, during treatment, and for 2 months after your last dose of Danyelza. Talk to your healthcare provider about birth control choices that may be right for you during this time. Tell your healthcare provider right away if you become pregnant or think you might be pregnant during treatment with Danyelza, are breastfeeding or plan to breastfeed. It is not known if Danyelza passes into your breast milk. Do not breastfeed during treatment and for 2 months after your last dose of Danyelza. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of Danyelza? Danyelza may cause serious side effects, including C. What is the most important information I should know about Danyelza? Swelling of the heart, myocarditis. Myocarditis has happened in adolescents ages 12 through 18 within days of receiving Danyelza. Tell your healthcare provider if you get any signs or symptoms of myocarditis, including chest pain, shortness of breath, irregular heartbeat, or feel like your heart is racing. High blood pressure, hypertension. High blood pressure is common in people who receive DANYELZA. Your blood pressure will be monitored during your DANYELZA infusion, and at least each day on days 1 to 8 of each DANYELZA treatment cycle. Tell your healthcare provider right away if you get any signs or symptoms of high blood pressure, including headaches, seizures, nausea or vomiting, chest pain, dizziness, visual changes, shortness of breath, feeling that your heart is pounding or racing, palpitations, nosebleeds, decreased blood pressure, orthostatic hypotension that can be severe and require hospitalization. You may feel dizzy, lightheaded, or pass out, faint when you rise too quickly from a sitting or lying position. Your healthcare provider will monitor your blood pressure before you start and during treatment with DANYELZA. The most common side effects of DANYELZA include fast heart rate, vomiting, cough, nausea, decreased white blood cell, red blood cell, and platelet counts, diarrhea, decreased appetite, tiredness, skin rashes, decreased level of potassium, sodium, and phosphate in the blood, hives, fever, headache, injection site reaction, swelling of the body or only in one part of the body, anxiety, irritability, increased liver function blood tests, decreased blood sugar level, decreased calcium levels in the blood, decreased protein levels, albumin in the blood. These are not all of the possible side effects of DANYELZA. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088.